Do you have Hashimoto's thyroiditis and wondering which foods might be triggering Hashimoto's thyroiditis? My name is Dr. Terranella, and in this video, we're going to look at the specific foods that are likely to trigger Hashimoto's thyroiditis, the importance of looking at this in general, and some other tips and ideas on the relationship between foods and Hashimoto's thyroiditis. Again, my name is Dr. Terranella, and if you're new to this channel, I just want you to know I'm making these videos to help you go beyond the basics of your health, whether it's a laboratory test, symptom, or diagnosis. Make these videos to help you get a better understanding of what's going on with your health. So if you like this kind of information on nutrition, lab testing, hormones, and overall health, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's look at what foods to avoid with Hashimoto's thyroiditis. In this video, we're going to specifically look at what foods to avoid with Hashimoto's thyroiditis. So there's lots of information about diet and Hashimoto's disease, Hashimoto's thyroiditis. So I wanted to bring my clinical insights to the table and help you navigate what's actually important here. The general idea with this topic is that there are certain foods that can trigger your immune system more than others. In the process of getting triggered, your immune system makes a mistake and it creates an antibody to certain aspects of the thyroid tissue or certain enzymes like the anti-TPO antibody. And it does that instead of making an antibody to food, for instance. And that's because of molecular mimicry. The food protein has a similar molecular structure as the tissue or protein on the thyroid gland. Once that mistake is made, it can't unwind that. So every time it sees the food, it's actually going to make an antibody to the thyroid tissue. So you're eating the food, and every time you eat that food, the immune system says, hey, there's a problem here. And instead of going after the food, it's getting activated in your thyroid gland. So that's not always the case on how this works necessarily with food. Sometimes it's other things too, which we'll talk about. But the idea that you need to grasp is that there's a mistake that's made, and sometimes foods can be the trigger for that mistake. Now, certain foods are more likely to do this than others. And these foods are generally referred to as allergenic foods. And one can eliminate these foods via an elimination diet. And they're going to do this, number one, to see if they feel better in terms of energy, mood, etc. Number two, to see if they get less joint pain or inflammation, to see if their digestive function or digestive symptoms reduce or improve, and if their actual laboratory tests improve as well. So the elimination diet has been rebranded, or he changed the name to AIP diet, which is also known as Autoimmine Protocol. And that's basically because that type of diet can reduce the symptoms and it may help with a lot of autoimmune diseases in general. And that's based, again, on that molecular mimicry. So what food should you avoid if you have Hashimoto's disease? One could say that all of these foods on the AIP diet or elimination diet could potentially be triggers and should be eliminated. But not everyone is going to be triggered by all of these foods. At the top of everyone's list definitely should be gluten. That should be the number one thing to try. If you're only going to try one, make it gluten. But again, not everyone is going to be triggered by gluten. So I suggest measuring actual labs and symptoms after a period of elimination, maybe 3 weeks, 6 weeks. Once you do this, you reevaluate those symptoms or the labs to see if things actually changed in your favor. Some of the foods on the AIP diet are things like eggs, dairy, citrus, soy, corn, gluten, nightshades, sugar, and sometimes people will eliminate certain other animal products like beef and even pork. So one research study that I found actually did take this approach, and I wanted to share some of the specific results of that study with you. The study aimed to investigate the effectiveness of AIP diet as part of a multidisciplinary supported lifestyle intervention for patients with Hashimoto's thyroiditis. As we said, the AIP diet is eliminating those potentially inflammatory foods. The study included 16 participants, and followed them for a period of 10 weeks. During the 10 weeks, they received supportive care from healthcare practitioners. And this study found that the AIP diet did lead to significant improvements in quality of life and several biomarkers associated with inflammation. Specifically, they looked at hsCRP. However, there was no statistically significant changes in thyroid function, including TSH, free T3, free and total T4, and thyroid antibodies. Inflammation, as measured by that hsCRP, did significantly decrease by 29%. So it went from an average of 1.63 to 1.15 after. So that's not really a big difference when you look at the broader scheme of things. Less than 1 is optimal. A little bit over 1 isn't really a huge deal, although it is better if it's less than 1. I think that the overall sample size, being a smaller sample size, probably played a role in not seeing very large effect. And also, if the patients were already fairly healthy to begin with, you're not going to see as much of a change on those numbers. I'm not sure how they selected the patients and if there was any bias towards how healthy they were to begin with. But of course, a larger study, you'd get much different ranges of CRP levels. One of the main things that you would hope to see a change in is the thyroid antibodies. Now, perhaps there wasn't enough time, but 10 weeks, I would expect to see some changes over that time frame. In general, in my practice, I do see that dietary changes do influence autoimmune issues and specifically Hashimoto's thyroiditis. And I find it very helpful to do these trials or actually do a test to find out which foods are going to be more important to eliminate. Usually in my practice, I recommend challenging those foods after a period of elimination to see if anything noticeable happens as well. That's kind of the gold standard. Another important variable or factor to consider is foods aren't always the trigger for a lot of people with Hashimoto's thyroiditis and autoimmune issues. Another important variable is the microbiome and the influence of the microbiome on autoimmune conditions. This is a topic that I think is underrepresented because it's more complex and it's not as black and white as just eliminating a food. It is something that is being researched quite actively, and recently a study found that a specific bacterial protein from a specific bacteria fit the exact molecular structure of antibodies for RA. Put another way, they found that there was a definitive link between the bacteria found in our digestive tract and RA. Of course, further research is needed, but this is a kind of research that supports the role of gut health, leaky gut, and things like this in autoimmunity. So overall, yes, I think eliminating specific foods, especially those top 3, dairy, gluten, and eggs, are really helpful with any kind of autoimmune disease to see if there is any change in your symptoms or actual lab values. It's at least a good place to start. But you have to look at the whole context of the person. There's always going to be unique circumstances for each person that need to be considered both in the analysis of your labs and also your symptoms. That's where the clues are to help you get to that optimal state of health. So how'd I do? Did that help you better understand what foods to avoid with Hashimoto's thyroiditis? Hopefully it did. If not, drop your question in the comment section below. Thank you again for watching. We'll see you next time.